Hello, and welcome to the online version of our Service and Leadership Making Sense of Pre-Health Credentials. First, the definition of service, as defined by the dictionary, is the occupation or function of serving. The general default for most of my students tends to be for the pre-health profession's service to others as the assumed. And here we have the definition of leadership, the office or position of a leader, or, and most importantly, I think for the purposes of this presentation, the capacity to lead. So when it comes to how you are going to gain your service or gain your leadership, it is very tempting to say, what does everybody else do? And try to do that. But that is not the thing that is going to help set you apart for the purposes of a health professions application. You do not want to be generic volunteer. You do not want to be generic exec board leader. You want to try to find something that is going to help you and your application set itself apart from the thousands of other applicants that they may be reading in any given application cycle. So when you're trying to think about how you're going to gain your service and leadership activities, I want you to think beyond just how can I check a box to detail that I have service, or how can I check a box that shows that I've had a leadership position, and think instead about how you can effectively convey that you are in possession of the necessary soft skills or competencies in interpersonal and intrapersonal ways to demonstrate that you are going to be a successful healthcare professional. These are competencies outlined by the AAMC. And please remember, as I'm stating AAMC and competencies for healthcare, I may shorthand to MED, but all of these are overarching necessary competencies for all of my healthcare professionals, whether you're dental, PA, PT, or anything that is going to be in direct patient care. I want you to think of service orientation in that it demonstrates a desire to help others, and that you have a sensitivity to others' needs and feelings. It demonstrates a desire to alleviate others' distress, recognizes and acts on his or her responsibilities to society, and this can be locally, nationally, and globally. That's, again, where part of this cultural competence and social skills come in. Teamwork is the ability to interact with others, hopefully both like and very different from yourself. Oral communication, the ability to speak with others. Ethical responsibility to self and others, reliability and dependability, resilience and adaptability, and the capacity for improvement. Understand that the majority of my students will try to volunteer at UNC Hospital Systems, and I get it. It is convenient. It is right here on campus. It is not far from your classes. Maybe you don't have a car and it's within walking distance. But I'd also like to point out that there are many of the positions within UNC Hospital volunteering that are specifically clerical, and only 2 of the most current 9 needs would even put you in a patient care setting. And remember, even though you are in a patient care setting, this is incredibly different from clinical shadowing. You are in a patient care setting, you are seeing some doctors, you are in the room with healthcare professionals, but you are not demonstrating a concentrated observation of them throughout their entire day and the entirety of a doctor-patient relationship. I would also like to point out that UNC Hospital volunteering, just think about how many times a day an admissions committee member is going to read that in any student's application, to the point where it may almost be a non-issue. Question you might be asking is, okay, well fine, how do I get started with volunteering, maybe on campus, maybe in the community? The Campus Y is an amazing place to get started. It owes its origins to the YMCA and the YWCA, but it did distance itself from its national parent organizations and removed itself from its gendered religious origins. During the early decades of the Y's history, it effectively functioned as the student union, serving as a hub for student leadership and social activism, and as the leading organization for student action addressing issues of integration, free speech, gender equality, workers' rights, world hunger, apartheid, and armed conflict. Since the 1970s, the Campus Y has worked for social justice as a department within the Division of Student Affairs. The organization has journeyed from its origins to become a pluralistic, diverse institute that champions civil and human rights, not just in North Carolina, but around the world. It has probably close to 30 committees at any given time, and here is just a smattering of some of the social justice organizations that range from public health, global issues, youth and education development, and advocacy in general. We have a Drink for Tomorrow, The HG is Hope Gardens, a local community garden. Best Buddies and Hype are both mentoring. Embodied Carolina is public body positivity. And then we have Rethink Psychiatric Illness, awareness of mental health issues, and food sustainability. It is amazing the disparity between the haves and the have-nots on the UNC community campus and how many students are actually in need of nutrition and in need of food security. Question you may be asking is, okay, well, that's fine. How can I get some leadership activities? Well, you may notice that we have a UNC Chapel Hill Student Life and Leadership Office. It always boggles my mind that students will say, well, how can I get research? I don't know. Have you looked at the Office for Undergraduate Research? How do I get leadership? Maybe at the Leadership Office. This is some of the statements available on the Student Life and Leadership website, and I have taken the liberty of bolding some of the key themes that I feel overarch and intersect with some of the competencies and the interpersonal and intrapersonal characteristics that are also competencies for AAMC and future health professionals. Here is one example of a structured leadership program. The Bonner Leaders Program seeks diverse applicants who have demonstrated a commitment to community service and civic engagement and wish to further develop their leadership skills. This is available through the Campus Y, so it is both service and leadership, and you will notice, if you have not picked up on it already, that there is a huge intersection of service and leadership and skills that can be developed between the two within the same organization. Some things that I grabbed with my very minimal Google Foo skills from the leadership page. We have an NC Fellows, we have Leadership Institute, ACC Student Leadership Symposium. We have Carolina United. These are programs that are usually yearly, so while I have outdated data, they will probably be updated information on the leadership site if you wanted to take a look at it. But wait, there's more. Absolutely, there is always more. Just a screen grab from the Student Organizations Directory. The number is probably different now because there are frequently new organizations being started and some that have gone defunct. But if you look, there are over 800 student organizations, and all of them will have an exec board as part of it. But even if you narrow that down to just those who may have help somewhere in the title or description, that's still over 100. We have CPPAA, the Carolina Pre-Physician Assistant Program. We have AED, Alpha Epsilon Delta, the Pre-Med Honor Society. We have CPMA, Carolina Pre-Med Association. DDS, ASDA are the number 1 and 2 pre-dental organizations. We have the Pre-PT OT organization, and those are just those that are specifically health-related. There are many, many others that have service or social justice outreach opportunities within them. Something I like to bring up about the Buckley Public Service Scholar. Here is the part in the presentation where I usually say, hey, somebody tell me what you do as a Buckley Service Scholar. And they'll inevitably say, we have to gain this many hours of community service, we have to document them, we have to go to some workshops, blah, blah, blah. And I usually say, that's great. You've just told me everything I need to know about Buckley Public Service Scholars and absolutely nothing about you. It's the same with Bonner, it's the same with these workshops, it's the same with these symposiums. I don't want it to be just a line on a resume. I am this, I joined that. It needs to be meaningful, and it needs to talk about where it put you and how it helped you grow in either the position or your path to become a healthcare professional. Through Buckley Public Service Scholars, I participated in this activity. I went on this Apple Service Learning Alternative Spring Break. I did this in this community as part of my growth as a Buckley Public Service Scholar. That is the framework that you need to keep in mind moving forward on any of your service activities, on any of your clinical service exposure opportunities, on any of your shadowing experiences. It does not just need to be, I did this on this date. It needs to become, this is what I learned, this is what I saw, these are the things I did as part of. Opportunities and service outside of UNC Hospital, because no, there is no shorthand that exists for volunteering means volunteering at UNC Hospital. and somewhere along the way the myth presented itself that you volunteer at UNC Hospital, you get a job in a research lab, you do good in your classes, and you're good to go for medical school. That is not the path to any health professions program. You need more than that. A lot of my students will seek opportunities at hospitals in their hometown when they go back for summer breaks, when they go back for long weekends, when they go back for winter breaks. There may not be as much foot traffic at some of these smaller local hospitals, so you may be able to gain a bit more depth. You may be able to establish better networking opportunities. Mom Clinics is predominantly dental. That stands for Missions of Mercy, and they are mobile dental clinics in much the same way ECU has a mobile dental clinic, and there are care clinics that crop up around the state. Low-cost clinics are usually referred to as indigent population, low-resource, under or uninsured population clinics. Sometimes Mercy Style or Samaritan are some names that you may want to be on the lookout for. I know we have Good Samaritan out in Durham. So those are things to also be on the lookout for in regards to service opportunities and clinical exposure. Foreign service, you need to be incredibly careful because the number of programs that have begun to enter the scene and have taken on predatory characteristics in that they will charge you a lot of money to put you in an unsafe country or situation and have you participate in things beyond your scope of skill or certification, thereby causing problems and potentially inflicting more harm on a native population than good, is something that you need to be aware of, and you need to plan very carefully in the event that you do want to take part in something like this. This is a link to a resource that a colleague of mine at the University of Minnesota created called the Global Ambassadors for Patient Safety. It has several online modules that you can scroll through, and you can become aware of some of the questions you need to ask yourself either before you select a trip, before you go on a trip, or after you're done with a trip, and how to discuss the activities that you took part in the most positive manner. I hear conversations with students, I have conversations with students frequently who say, I'm in athletics, I'm a student athlete, or I'm in a fraternity or sorority, and maybe that's not something they want to talk about as part of their application because they feel like it's not medically relevant and it may not be looked on as positively. Well, as part of athletics, you have the Leadership Academy. You have student athlete leadership development as part of the opportunities afforded you. You also usually take part in some kind of community outreach with the team. So I want you to focus on harnessing those activities and making them work for you. Maybe spearheading a particular activity with your teammates. Same with fraternities and sororities. If you don't know immediately what your national philanthropic focus is, then you're probably not taking part in a meaningful activity within a fraternity or sorority. If you do, then absolutely use that to your advantage. These are both activities that take up hours in your day and may preclude from other activities because of your commitment to them. So we need to work smarter, not harder, with those activities. One thing that's not listed here but was brought up in the presentation recently in person was part-time jobs. There are people who need to work to put themselves through school, and because of that, it does preclude a lot of the student activities and student organizations and extracurriculars that other students may have. But working and maintaining a positive work ethic and being able to allocate your time effectively and taking on responsibility within a part-time job is absolutely something that can be harnessed as a positive framework for a future application. Existing memberships and clubs, are you on an exec board but not doing anything? Change that. If you're not on an exec board but you do still have an idea for an outreach activity, then roust your brothers and sisters up and go do something on a weekend. Organize a fundraising event. Organize something out in the committee. That is still what is generally referred to as charismatic leadership. If you will remember from earlier in the presentation, the definitions of leadership are the capability to lead, not necessarily the formal structure of holding an office. Longitudinal activities, anyone who's ever been to a workshop with Dean Bashford from UNC Med has heard the word longitudinal. He loves it. I usually like the term intermittent and ongoing, meaning I've done a service activity and when I don't do it, I miss it, so I try to find another way to get involved. Maybe that's going to be through regional or national organizations, so it's something that if you did in high school, you can continue in college, and you can continue through medical school, or you can continue through a gap year opportunity. Those are things to think about. But even if you have a smattering of different organizations, if you can link them together with the common thread, maybe it's HYPE one year, maybe it's Best Buddies the next, maybe it's tutoring in an after-school program the year following, that may technically be 3 different activities, but it is still mentoring youth education. So think how all of your activities can be linked in. When it comes to journal reflections, I know a lot of you, and personally I do too, think of the whole Dear Diary and view it kind of tritely. But it is incredibly beneficial, because remember what I said earlier, it is not just I did this, I joined that. You need to talk about what you learned, you need to talk about what was surprising to you, what was edifying for you, what was horrifying for you. There are always going to be some things that are eye-opening during service experiences or during clinical exposure opportunities. So writing everything down is going to be beneficial for future development of your personal statement, future reiteration on your applications, because remember, there's a Common App for every health profession school, and you have to put in every single history thing you've done in the history of ever. So you need to have an accurate record of that so that you can recount it for your application later on. That's the benefit of journal reflections. I'm bringing it back to remind you of the interpersonal and intrapersonal skills. It is not just, I did a service activity, I volunteered at UNC Hospital. What of these skills do you think you positively demonstrated as part of your activities at UNC Hospital? Obviously, it was service. You were giving away your time for free. But there's a difference between giving away your time for free, volunteering, and service to others. It's the difference between volunteering for a UNC football game where you're checking purses at the gate. Yes, that's technically giving your time away, but what good for your fellow human being is it serving? Social skills, cultural competence, teamwork, oral communication, ethical responsibility to self and others, reliability and dependability, resilience and adaptability, that is, what happened if I fell down, how did I dust myself off and move forward, and capacity for improvement. Now that's a tricky one for a lot of my undergrads, because capacity for improvement means that you have to be self-aware enough to realize that you're not perfect and to point out the ways that you could stand to improve. So that requires a special level of introspection that most 18 to 22-year-olds don't necessarily possess. Being able to do that is an incredible positive. So speaking their language, I want you to understand that you're going to see not just the AAMC competencies, but you're going to see language regarding other activities. Particularly here in University Career Services, we have the career readiness skills. There are creativity and problem solving, communication, professionalism and work ethic, technical application, wow, I have a random semicolon in there, global perspective, career management, leadership, teamwork and collaboration. Now, if you notice, half of those are almost verbatim some of the AAMC competencies, but others can absolutely be adapted to within the same meaning. Our career readiness are going to be linked to the excellence in action, which you're going to see as part of Heal Life, which is going to be part of your soft skills, your student organization transcript, that will be workshops and activities that you have attended that map to these particular character traits or these particular learning outcomes. So again, we have dynamic learning, that's back to critical thinking and communication. We have honor, ethics and integrity, fairness and respect for others. Those are huge competencies from both AAMC and our career readiness responsibilities. Personal responsibility, community engagement. You will see activities coming up through the student activities sections, through student organizations, through workshops and info sessions conducted through student affairs that will be mapped to these excellence in action traits. Think about how those words and those skills translate to the AAMC competencies so that when you are referring to that activity, you have the skill built into the language of the description. That is an excellent tactic to take when it comes to mapping out what beneficial workshops you're going to want to attend and how to plan out your semesters based on that. Now, ask yourself, what would Steve Rogers do? You want to make Captain America proud, and that's of course before the Cosmic Empire, the Hail Hydra storyline. I hate that. This is your final reminder that your pre-health advisor is a total comic book geek, and I dislike the route that Captain America went. So before that storyline, What would make Captain America proud? Did he stop and help somebody? Did he stop and advocate for somebody? Did he stop and teach somebody? Those are the things that you want to think about when you're thinking, what can I do for service? What can I do for leadership? It is not necessarily a position. An exec board can be meaningless if you don't use it for some purpose. But even something as simple as being a peer mentor, which is not simple when you think about it. Something like being a TA, something like working with the Learning Center and doing peer tutoring. These are things that are not just interpersonal. They're communicating. They're displaying that your communication skills are solid enough that you can teach complicated concepts to other people. So all of these are things that are beyond just checking a box, that are meaningful activities conveyed effectively for a competitive application to any health professions application. I don't think you have to do this, but I don't think this survey is going to be live. It was available for my students who were in the actual session, but in case it is, you feel free to go click on it, talk about what you learned from here. And then again, best of luck. There are going to be lots of resources available on the Pre-Health website in my absence. This will be there, links to the Campus Y, links to some of these student organizations, and links to other entities on campus. And hopefully within the next little bit, I don't know what that will be, they will have somebody who can help fill the gap for student appointments in the absence of me. Thank you for your time.